Our pediatric physical therapy program focuses on creating motion and improving function in children. We are working on gross motor skills, including rolling, sitting, standing, walking, all the way up into jumping, hopping, and skipping, so that those children can participate in the community, participate in their neighborhoods, and participate in the classroom with their children that are their same age. Some of the ailments that we see in our pediatric physical therapy program consist of torticollis, toe walking, orthopedic injuries, or just general gross motor delay. All of our exercises are geared towards that child, and it's specific on their interests. So we bring in toys, we bring in mom and dad, we bring in siblings, and then we perform activities that are going to encourage them to either sit up on their own, crawl on their own, start standing and walking. Torticollis is typically either bending of the neck or limited rotation within the neck. Anywhere from 3 weeks to 6 months. That is our prime time to treat any infant or child that's been diagnosed with torticollis. Toe walkers, the sooner that we can get them in, the better. So any ages between like 3, 4, 5, and 6. And then our pediatric program consists depending on the gross motor delay or the orthopedic injury. It is common for children to walk on their toes in the early stages when they start to walk. They typically start to grow out of toe walking when they become 3 or 4. My patient that's coming in, he had a cona equina, so he had a spinal cord injury at a young age, and he had trouble developing and achieving his gross motor skills.
Isaac was 3 when he started working with Larissa, and so I just called around to places in our area. I actually went outside of insurance, and Spooner worked with us to be able to negotiate like a single case contract so that we could work with Larissa. We were with another physical therapist, and we needed to kind of make a change, and Isaac just immediately hit it off with Larissa, so we knew that was a good place for him to be. He was having a hard time stepping up curbs and going down curbs. That's just something very basic that you have to do every day.
Right now he is working on hopping, he's working on jumping, he's working on standing on one leg and walking backwards, so he can do all these things with his friends in the classroom.
So they've kind of started off small, now they're working on some other things.
I communicate with all my patients' parents. I encourage them to come back to all of their treatments so they can sit and watch. A lot of times they can be a part of it, and then each time that they leave, the parent knows what activity they need to be working on for the next week.